All right, let's get into it. I am expecting a few more people to join throughout the hour, so we'll see how we go. All right, well, look, everyone, thanks for joining today. I'm CEO, co-founder of Foxo. We've also got a few panelists on board, Alf and Rob, also from Foxo. They'll be manning the Q&A channel, so please feel free to throw through any questions or comments. Today we'll be covering off on Foxo as a product, but we'll also be talking about how the current state of industry, so the current climate of communications across radiology and the impact of communications and the lack of some particular software and security and innovation. And we'll look at a case study as to what we've done previously with a large radiology firm here in Queensland. And then we'll jump over to a demo as well. And we'll open it up to Q&A. So as I mentioned, please drop in any questions that you may have. And just to note, we are recording this. We'll be sharing this out with all the registered attendees. So this is our opening statement that we often work with. And it's a broad brushstroke on the current state of the industry. So health is yet to see a powerful, interoperable, purpose-built platform that connects the industry in real time. And what we're really talking about here is real-time connectivity, using innovative methods to connect between silos or institutions, and also a powerful interoperable process. So leveraging existing systems to connect those up, and not just connect the systems, but connect the people that use those systems. Now, the lack of such connection across the industry leads to adverse effects for businesses, and in particular radiology, because we focus on radiology because we're very cognizant that there's a lot of in and out roads in terms of communication. So bookings, referrals, test requests, advice, contracts, teleradiologists, everything in between. And because communication is such a challenge in the industry, there's been a lot of processes that have been band-aided together to try and solve some of these. And because there isn't truly a holistic platform that is purpose-built to serve this purpose, we see a lot of impact on patient harm, communications, costing in malpractice, and also a leading factor or trend within malpractice claims being communication breakdown. So the demand for such a platform, or for the ability to communicate in the real-time context, leads to a lot of fallback or shadow IT that we see. So people are using Facebook Messenger, SMS, WhatsApp even, Facebook groups, and recently Microsoft Teams. And this is primarily to solve a communication barrier, either internally or externally, and also to communicate within context. So to communicate not just sending information, but about a patient, whether it's a scan or advice or a booking or a test, whatever that might be. And because people are either falling back on this process or leaning back on SMS, on email or phones, a lot of time is wasted. We're seeing down the bottom line here, 60% of clinicians' time is wasted, spent searching or waiting for patient information when it's there, it's readily available, and it can be reached. And because we see this happening, we've actually reached out to our network, and this came through in droves. And this isn't a surprise. We're very conscious that this is just what's happening across the industry, and that's why Foxo exists. So Facebook Messenger, SMS, Facebook groups, WhatsApp, whatever it is, it's being used because there's a gap in the market, and that gap is real-time connectivity within your network and with your extended network. And this is, when we look at radiology as an industry, with a variety of challenges that we've highlighted, that these actually born into opportunities for business. So we're looking at security and innovation, both at different ends of the spectrum, some would believe. And if we bring those two together, there's a great opportunity for radiologists and radiology businesses to really innovate and transform their business. So these are just some of the trends that we're seeing that are being used for Foxo, and why people are talking to us today. So people are relying on real-time communication to do a lot of these things. And that's where either security flaws come into play, or process just simply isn't there yet. So today we'll talk about Foxo and how we resolved a number of these issues, and not just resolve them, but really revolutionize a business that we'll be showcasing in just a moment. And not just changed processes, but truly elevated them. And they've seen a bottom line shift in terms of revenue and cost and savings, as well as all of the other benefits that come with real-time communication. So just a couple of use cases. We're not going to go through all of these, but these are some of the things that we're happy to talk with anyone on this call further on. So alleviating phone calls or the call center, reducing referral leakage, shifting workloads, and we'll talk about this one quite a bit. So how do we shift an expensive radiologist's time when they're working on, say, administration tasks, and pushing that into a clerical team that can do that on their behalf, either more effectively, more cost effectively, and leave the radiologist to remain focused on reporting and what they're really good at. Internal communication. So a lot of businesses are either using Slack or Microsoft Teams or even WhatsApp, whatever that might be. But having an interoperable platform that communicates with your radiology information system or PACS, whatever that might be, is paramount for these conversations and business to be had. On-call communication, so coordinating with staff within and beyond your organization, and then also organizational broadcasting. So cutting through the white noise of email, where we see a lot of group emails being sent out across an organization. You can do that within Foxo. It's as simple as pushing out a push notification and everyone receives that. And I often say this, email is dead. There's a better way to communicate. So the two use cases that we're going to draw focus on today is shifting workloads and reducing referral leakage. So as I mentioned, shifting workloads is all about reallocating tasks. So we know that radiologists are great at going from top to bottom and focusing, laser focused on what they need to do, which is reporting and analyzing diagnostics. But when it comes to something that's an administrative task, they've got to pick up the phone or they've got to send an email, they have to shift their focus. And that's when error comes into play. It impacts efficiencies. And there's just no need to do that when it's as simple as shifting that workload, the administrative task, into an administrator's process. So we've enabled that via a one-click integration from radiology information systems. And then reducing referral leakage. So we look at our referral base, so whether that's physicians, clinics, specialists, whatever that might be, and having them further embedded within the radiology workflow. And what that looks like is an integration at the practice level, where they can simply press a button and the patient is transported from their practice management system into your instance of Foxo for the booking to be made or the test to be allocated and organized. Now, those two workflows that we've just talked about, or use cases, have been paramount to the success of Qscan. They're seeing a lot of other use cases across their usage of Foxo, but essentially we're going to draw focus on those two. And Qscan is an organisation based in Queensland, here in Australia. They've got 1,200 staff, quite a large radiology network for Australia. And those 1,200 staff are dispersed across 70 clinics, so it's quite a dispersed workforce. They've got a number of hospital contracts where they're dealing with imaging departments, and they've got thousands of referrers that they need to connect with. So as mentioned at the top of this call, there's a lot of opportunities here for communication synergies, easing the friction between these parties. And that's what we've really focused on, because there's a lot of net benefits when we can get these things working. So the problem that Qscan faced when we engaged them was their radiologists were wasting a lot of time. And we equated that, and we've got some calculations that it equates to almost $10,000 worth of time every week. That's quite significant when you've got a high cost individual such as a radiologist burning time on administrative tasks when it can be very easily pushed out of their workload. Referral leakage, as we just mentioned, those were some of the key targets that their business are really focused on. So it's quite an aggressive growing business. They really want to look at how they can optimize their referrer base and ensure that the bookings come through and they're made. And then embedding and connecting their staff, their clinics, their teleradiologists, their hospital contracts and the like, all within the one roof. It's very siloed. And they really wanted to draw them all in together. So the solution, we deployed Foxo through a brief pilot. We've now pushed that through pilot. And during that stage, we've built out a number of environments using Foxo for them, which I'm really keen to show you in just a moment. So the solution was we created what they call a radiology concierge, which essentially is a team of people that the radiologists can shift work to from their radiology information system with just one click of the button. So they're going through their work list, they come to a case, an encounter or a visit, and there's something wrong with the billing, they can press a button that goes out of their system and into the hands of an administrator to resolve, phone the patient, phone up the hospital or whatever that problem might be. And then embedding seamless workflows from the referring clinics into the bookings team at their business. So that's the referral leakage. And what they've done there is they've created these direct paths from their referral network straight into their team. And launching Foxo, very similar to something like an enterprise communication tool, has reaped a lot of benefits for the business in terms of real-time connectivity. So they're now able to communicate with anyone across the business, no longer siloed in a small chat platform that's embedded within the PACS or a WhatsApp app over here. Everyone is using the one platform. They can communicate within context, with patient information, and also communicate with the referral network and hospitals as well. So it's created this really wide-reaching, dense network of the users within to be able to communicate and get their job done really efficiently. Right, so the outcomes of this engagement were quite significant, and it's still early days. You know, the contract has only been going on for 6 months, and the trends that we're seeing right now are fantastic, and you know, they're really excited, and so are we. So we've been able to shift workloads from to low-cost individuals from high-cost staff. It's a tongue twister for me, sorry. And we've eliminated radiologist time on administration tasks, which results to almost $500,000 per annum. That's Aussie dollars. We've improved efficiencies and accuracy. So the result of keeping a radiologist on with their clinical mind on task pays a lot of dividends in the end. Going from one to the other, one report to the next, versus having to shift around, change workflows has vastly improved. And we're running a survey with these guys. We talk with them quite often, and it's overwhelming how positive they see this concierge service that they've rolled out. And optimized their referrers, so the one-click test requests or the bookings straight from the doctor's office. Now, this hasn't just improved the referral rates from this collection of GP clinics, but it's built much better relationships between the practice admin from those clinics and the administration within Qscan. They're now able to communicate without having to clog up their phone lines. You know, this business had a 20-minute on average wait time to call in and speak with somebody. And now using Foxo, it's all by text. Although, you know, we're soon launching VoIP and video conferencing. The text messaging is just such an easy way to get a message through, and people can service that as they need to. And at the end of the day with this process, it's a much nicer process for the patient experience. They're no longer walking around with a paper-based referral, not knowing who to contact, who's the best person to book in. the business Qscan actually call the patient and book them in. They get further information on that call, you know, whether or not they have accessibility disabilities, or, you know, whatever else that might be around availability. So that phone call is made and that patient is booked really efficiently. Right, so those are just a couple of the use cases. There's a lot more that we'll happily dive into with a Q&A. But essentially what we're looking at today is Foxo as a communication platform. We call it an enterprise tool because we're really looking at the larger networks, but this really doesn't infiltrate down to the individual. So an individual trying to communicate with another individual, so long as they're within the health sphere, they're approved to work, to join the Foxo network. Foxo, everyone that joins Foxo is independently verified. So we look at all of the credentials that we capture, we review them. If we have any concern, we reach out to them and we'll either enable them to proceed or we'll deactivate their account. So similar to something like a LinkedIn network where we're really promoting professionalism, that comes through here as well. Now, Foxo is available on desktop as a browser app, which I'll be showcasing today, or a desktop app, which can be installed. Additionally, it's also available on the iOS and Android store. And if you're dialing in from international today, we have restricted some locations on the app stores. So please reach out to us if you'd like access to those. Okay, so now I'll just be switching over and showcasing the demo. Please ensure that you use the Q&A if you would like us to follow up on anything that we showcase here today. Right, so here we're looking at my profile. This is much like a LinkedIn profile and as easy to set up as a Facebook profile. So you get onto Foxo, you register your account, you fill out your details and away you go. Over a period of time, you'll be prompted to complete your profile and enrich that. And it's really quite important because as a professional network, we encourage anyone and everyone to add their credentials so they can be found or at least verified when somebody's talking to them to make sure that they're under the right specialty, profession, and they are who they say they are. Now, there's a lot of options under the hood here. We won't go through them all today, but importantly, we do have our settings. So a user can manage their settings. So privacy, email settings, status, if they're away, for example. But we won't go through all of that. What we'll be looking at today is those two use cases that we covered off on being the concierge service, so shifting workloads, and the GP referral leakage. Sorry, almost lost me there. Just quickly, I will showcase what else we've got here. So messaging as a core foundation of the product. So we can talk to Alf here. Hi, Alf, I know you're on the call. You may not be logged into the staging platform just yet, but Alf and I can have a real-time conversation. Now, the beauty about this is Alf may not be within my organization. So something like Microsoft Teams, let's see, Alf has just come online. Microsoft Teams or Slack, you know, you're kind of limited to your organization. But what we're building here is a wide-reaching network. So Alf might be from another organization. He might be from a hospital or from another clinic. So now I can build out a multidisciplinary group, whether it's one-on-one or a group message thread with a variety of users from variety of specialists from other organizations or from within to communicate in real-time setting. And my phone and my watch is buzzing now because Alf's online and he said hello. So I can manage all of those within the settings. Then we've also got our patients. So these patients here might have been extracted out of a RIS or a PACS for the purpose of communication. So we have what we call the concept of a patient card, which is a document environment similar to a Word document where multiple people can communicate. So I can say, hi, Alf. I'm not connected with Alf, so I can say, hi, David, and we'll invite him in. Now, David and I can have a conversation. So I won't go too far on the patient card here, but essentially this is a transport layer beyond your RIS or PACS to communicate with other users beyond your institution or within. What we will look at now is our Teams environment. So here we have the concierge team. Again, this is quite similar to a chat thread where I have my colleagues within this room. So Jane and I are having a chat. We've shared some media, but what we're seeing here is a more in-depth or a feature-rich environment. So we have the ability for users to submit a case to this team, and these are our cases here. So a case could come from another radiologist within your organization, or it could be from within. But in this use case, we'll say from maybe a radiologist, and this team here is the concierge team. So here, Jane and I are having a conversation, and as we're going about our day, coming in from Dr. John Snow is a new case. So in this scenario, either Jane or myself can go off and claim this case and resolve this for Dr. John Snow. And what that looks like for Dr. John Snow is he would have been in his radiology information system, going through his reports, and we can see here, number one, pressing the send patient to Foxo, opens a dialogue where you choose the team, which looks like this, the radiology concierge team. You make a note, there's incorrect billing, please resolve it, and you press confirm. And that results in this. So that information comes out of the RIS straight into the concierge team's environment. So now from here, Jane or myself as an administrator can look at this patient in more detail. We can see what the information is. We can claim this case. We can communicate back to the doctor. Hi, doc. And we've now got an open communication. Whether we need to communicate or not, that's arbitrary. We could also say, case is closed, all done, close that out, and we'll let the radiologist know that that workflow is now complete. So it's as easy as that. I'll just flip back here to the team chat, and we can see that what's happened here is everything is documented. So Jane and I were going about our day. In comes a new case from Dr. Snow, and Jane claims that, resolves that case, and marks it closed. And now Dr. John Snow can go on with his reporting. Quite simple, really. Again, this is all available on the phone. So if Jane was out and about, or even if Dr. John Snow had some other workflow issues beyond his risk, he could also engage this team, whether it's patient related or not. And now we'll go to the bookings team. So this here is quite a similar environment. Well, it actually is the same environment, but being used in a different context. So we have connected up the bookings team with a variety of GP teams or GP clinics. And it could also be connected to your web form bookings. So if you have a website that's accepting bookings, that can simply plug into this as well. So no longer are you seeing emails floating around and people trying to coordinate emails in a variety of different workflows. You can have all of your GP funneling through here, so GP being general physician, and all of your web bookings funneling into the one team here. So again, what this looks like for the GP, from their practice management software, they will see a very similar screen. They just simply press the Foxo button, whether the patient's in the room or after. They select the team, the diagnostic imaging team, or it might be the bookings team, for example. They press go, and what happens? That comes through, and we can see that Jane, in this example, has sent through a booking, and that could have come through from the GP. In this instance, it's come through the website. So again, we can go in, we can even talk with that doctor if we need to, and that doctor could be, just down the street, around the corner, or across the country. And we can solve that problem, or we can phone up that patient just by looking at the patient credentials that are provided, and we can book that patient in. And it's as easy as that. Now, look, there's a number of other features under the hood here we don't really need to dive into today, but just quickly, I will showcase, we've got organizations where an organization can have a news feed. People can subscribe to that, and we can send out wide-reaching information. So for example, if the risk is going to be down in this demo, or COVID-19 update, that will go out to all of their staff. This is also where the teams are hosted. So under the organization, you can have a variety of teams that people can find and engage with. and then obviously the members of that organization too. But I won't go too far on that, guys. That is pretty much the end of the demo. What I'll do now is just switch over and just quickly talk about what's coming up. So in the meantime, if you'd like to ask any questions, please go for it. So we are working on video calling as well as VoIP calling. That's to be released in 2021. We're not putting a date in the sand just yet, but the ability for you to be able to communicate internally and also with your external network via voice call or video call is going to be quite important. And then additionally, we've got a number of integrations that we're currently working with, and we've got a lot that we're also looking at as well. So integrations is what we do, and the purpose of an integration is to ensure that information transfers from those siloed RIS or PACS systems into Foxo to be able to carry that conversation to where it needs to be had, where previously an email or a phone call may have been made. All right, guys, well, look, that's it from me. If there's no other questions, then I'll follow up with a quick email off the back of this, and I'll also circulate a recording. Okay, thanks very much.